I'm Rabia Nizamani. I'm a burn surgeon and I am an assistant professor of surgery here at UNC. I'm also the service line leader for the Division of Burn Surgery. I became a doctor because I've always been interested in science ever since I was a little kid. That was my favorite subject in school. But I also loved being around people and working with people. I became a surgeon because in addition to the science of medicine, what I love is being able to provide a definitive solution for the problem that the patient comes to me with. In surgery, you really do find that, your patient will present with a problem. You have to think about the best way to treat it, and then you get to do it. You're not relying on a medication, you're not relying on anything else, but you really have to take that responsibility on and follow that plan through and make sure that you give the patient the result that they're expecting. I picked burn in particular because I've always had desire to have a visible effect with my operations, and burn really captures that. It allows you to do an operation and have the patient see the effect of what you're doing every day for the rest of their lives. That's a tremendous impact on somebody's life. It also allows me to keep some of the elements of medicine and critical care that other areas of surgery maybe don't have as much of. I get to take care of the patient on the floor in the ICU and then follow them all the way through their surgery and then until they're ready to go home. I get to be part of that entire process. I'm not handing that care off to anybody else. I chose to go into academic medicine because I do love to teach, and it's really exciting to take a concept that you love and that you know and to walk somebody through the process of understanding it, and then not just understanding it, but watching them implement that and take that further as they treat other patients. It's really gratifying to sometimes hear your words coming out of somebody else's mouth when they're taking something that you have taught them and then going on and teaching it to other people as well. I love that. I chose UNC because we are one of the busiest burn centers in the country. To me, one of the best places as a surgeon, as an academic, to come and learn. You learn by doing, and the more that you can do, the more that you learn. At the same time, the mission is very focused on the people of the state and what we can do for the people of the state. We have resources that many other burn centers don't have. We have support that many other burn centers don't have, and that means that we can just do so much more for our patients. We don't just admit somebody, take care of them, and then send them off on their merry way. We have programs, we have support for them long after they actually leave the hospital. I want my patients to know that the care that I would want for my own family member is the care that I would give to them or to their loved one. I've had family members in medical situations and I know how scary that can be. I do my best to make sure that I understand what my patients understand and that I get them to a point where they can understand and trust in what I'm doing. What I love about doing burn surgery is that I can really have an impact on somebody for the rest of their lives. But in that moment, when they're here, when they're suffering, burn surgery is so much more than just providing treatment to a patient. You're really caring for them and for their family. And care goes beyond the medical treatment. It goes beyond any medication, any operation, anything that we do to somebody while they're in the hospital. We say in the burn center, we say that you really become family, and that's so true. I see it time and again. Our patients and their families become our family. I think one thing that's important when you have a burn injury is that you know that you kind of have to come here. You're in a situation where you don't necessarily get to choose where you are. You don't necessarily get to choose who takes care of you. But I think it's important to know that everybody who's taking care of you really is invested in making sure that you have the best possible outcome. Regardless of what that looks like, we'll get you there.